Good morning, Don.
Good morning, Howard. How are you this morning?
Just fine. Thank you very much for being there and moderating. I'd like to welcome all of you at the course in Boston. It's exciting technology to be here sharing with you in this way this morning, and I'd like to thank Alcon for their sponsorship and assistance in this broadcast, and particularly Patty Hosh and Henry Mitchell there in Boston, and Ernie Bravo and Steve Roberge here in Calgary. And of course, William Austin, our producer, and all of the crew here. We thought that you may be interested in just a walkthrough of our surgical center. We're standing here between the two operating rooms, and there's the CSR, and we're going to just go back into the area where the patients are prepared for surgery, as well as where they come after surgery. We have two patients waiting in the operating rooms, but here we have Paul waiting for his surgery. Paul has had an injury and has a traumatic cataract, and he'll be the third patient. And we have a double room here where Dr. Hamilton prepares the patients, and Melody, the assisting nurse, and we'll be coming back for you to have Dr. Hamilton discuss his procedures there. Then further waiting area here, and I have an examining room that I can examine patients preoperatively and postoperatively. Now we're out into the waiting room, and from the waiting room the family members can move directly into our observation room, which we will move into next, where the family, if they elect, can watch the surgery. We also encourage family members to come right into the operating room. Good morning. How are you today, Liz? So we have room for quite a number of family members here, and sometimes classes and seminar doctors and nurses and so forth. We have a monitor in the room that the patient's family can see from outside the room. And Liz has a number of articles here that she will show the patients, instruments that we use, and the intraocular lenses and so forth. And then we have the recording facilities at the end of the room, and as well a system here that allows me to be in communication with you at this time, and also allows me to be in communication with the family here in the observation room. I can dictate to tape. I can hear the conversation of the assistant here with the family if I choose. And this is all voice actuated, so I can just switch myself from one thing to the other. And also receive telephone calls if necessary without having to go to a phone. Okay, we'll go back into the operating room, and I'll get started there, but we'll have the give you opportunity to talk to Dr. Hamilton now, and as I get ready to operate, and he will share with you what he does to get the patient prepared. And again, welcome.
Thank you, Howard. That was a nice tour. Appreciate it.
Good morning, Boston.
Morning, Dr. Hamilton.
My name is Roy Hamilton. I'm the anesthesiologist here. This is the preparation room, and I have a nursing assistant with me who is here with the patient, and it's an important preparation room. The technique that Dr. Gimbel uses in 99% of his cases is what we would call modified topical. The topical drops are Marcaine 0.75%. He also uses intracameral 1% preservative-free lidocaine, and when required, subconj lidocaine if there's a particularly stimulus-prone wound. in talking about the use of topical, I would say that it's not for every patient. If there's a patient that comes and says, I want to feel nothing, absolutely nothing, that might make me think that we should be doing a block in this room. Deaf patients are a little more difficult as well. And of course, any complex surgery